Hi, I'm Dr. Steve Myers, and I'm here with my patient Vera, who's been suffering with bilateral knee arthritis pain for many years. She is now 3 months after a stem cell procedure in both of her knees. Before we talk to her, we're going to take a quick look at her x-rays. Okay, this is a standing x-ray looking at both of her knees. This is her left knee, and this is the right knee. If we zoom in on the right knee, you can see severe arthritic change with severe loss of joint space. There's essentially bone-on-bone arthritis on the outside of the joint. Big bone spurs coming off of the joint. Bone spurs are part of arthritis. Looking at her left knee, very similar appearance with bone-on-bone arthritis, severe loss of joint space, severe arthritis, big bone spurs on the outside of the joint, indicating significant arthritic change. Okay, so let's think back to before you had your stem cell treatment. What kind of issues were you having with the knees? What kind of pain symptoms were you having and difficulty with your knees? Describe your symptoms in your knees.
It was very great. The pain was very great. I had been on steroid for a while.
Yes.
And then they moved to the gel.
The gel shots?
That wasn't being effective, and I still had a lot of pain.
So the injections had lost their effectiveness for you?
Well, they were not effective on me. I know some people do, but it was not effective on me.
What activities were especially difficult with your knee pain?
Most of all, almost anything. Of course, it was arthritis, and it hurt in bed when I walked. Almost any time I had almost constant pain.
So constant pain with normal activities, walking, even pain at night in bed?
It was walking, and even sitting over time, but not getting up, it was very difficult.
Now, here we are 3 months after your stem cell treatment. How do you think you're doing with your knees?
Oh, it would be nearly 100% improvement, because I have no pain, virtually no pain in my left leg, left knee, and very little in my right knee.
So pain with walking, has it gotten better?
Yes, I have no pain with walking.
And what about at night when you're sleeping or sitting at rest? How's your pain at rest?
I have none at night.
Having been through your stem cell procedure, here we are 3 months down the road, do you feel like you make the right decision with your treatment option for your knees?
Very definitely. I
Very
did
good.
make the right decision.
Well, thank you so much for sharing your story with me.